please practice just like your skills checklist shows you, okay? And I'm gonna be very literal, going by the steps. So even so much as to, if I miss a step, I want you to say something, okay? Okay. So the first thing I think it says is verify your order. Okay, so you're gonna have a chart right in front of you. And I've got a couple charts. One's gonna have some consent forms in it, and one's gonna have some orders in it. So I have an order for Robert Davis to type and cross for 2 units of packed red blood cells and give over 2 hours each, written by Dr. Bud Love. Okay, so I verified my order. Okay, and the next thing I'm gonna do is I'm gonna go see my patient. I'm going to wash my hands. I'm gonna walk in the room and introduce myself to Mr. Davis. Hi, Mr. Davis, my name's Peggy. I'm gonna be your nurse today. Dr. Love has ordered some blood to be given, and we're gonna be giving you some blood after I get all the checks done. I just need to check your IV. I see that it's green, so it's an 18 gauge, which is large enough to accommodate blood. And I just need to check and make sure it's Peyton. Wrong. Okay. And so this will be hands-on. Has your IV been bothering you or hurting at all? And of course it's going to say no. Okay, so I'm going to scrub for 30 seconds. Unclamp it. And then as I flush about 2 or 3, I'm going to assess the insertion site for any swelling, redness, or anything like that. Looks great. Did that hurt? No. Clamp it as I flush. And then I flush the IV. Okay? Mr. Davis, I'm going to have you look over your consent form and sign it. Did the doctor talk to you about your blood? Yes. Okay. So then I'm going to give my patient the consent form. Okay, and you do need to look at these things yourselves and realize that the patient signs where he signs, not in the witness place, so that you're not thrusting it under his nose and not know where to sign. But there's a patient signature and a witness signature. Okay, Mr. Davis, if you consent, sign here, please. I'm going to witness it, time and date it. Okay, before I leave the room, I'm going to go ahead and get a set of baseline vitals, and I would do a basic head-to-toe assessment as well. Okay, that's not on your critical checklist, but we have to have a baseline. So when you say you're going to get vitals, I'm going to hand you a set of vitals, or I'll verbalize a set, and you can write them down. Because our policy states that we have to bring a copy of the order, I'll take a copy of the order from the chart. I'll also look at his most recent H&H and his blood type. Let's just ask the patient. Mr. Davis, what kind of blood do you have? Will that work? No. Okay. All right, hold the bus. Leanne?
Ma'am.
I don't know where his blood type is.
Okay. Let me go to the blood bank.
Go to the blood bank, but it should be on here, his,
What do you need?
well, oh, here it is. Oh, look at how subtly it was written here.
Okay.
I see that his blood type is A negative.
Oh, wow.
Yeah, we'll make
Got
it.
it?
More,
We're good?
yeah, I got it.
Okay.
We'll make it a little more clear on the day of testing.
Yes?
Okay.
All right.
I'm good.
All right.
Okay, so he's A negative, and this sticker has everything on here, his 2 identifiers, and I know I have a copy of the order, the blood type, and I don't have a copy of his H&H, but that's going to be in the blood bank anyways, because they're the ones that would do the lab, so I can get it from there. Okay, so Mr. Davis, I just want to verify your date of birth, please, and he's going to tell me 3/25, 1948. And your full name, Robert Davis? Robert Davis. Okay. So I've identified him, I've checked his patency of his IV, I've had him sign his blood thing. I've checked my order. What else? Did I miss anything before I go to the blood bank?
Transfusion
Oh,
history
yeah,
and allergy.
okay. Have you ever had a blood transfusion before? Yes, I have. Have you ever had any trouble with it? No, I haven't. Okay, before I leave the room, thank you, I would have forgot that, but not a deal breaker. It's just to ease your way. I'm gonna go ahead and prepare your saline before I leave. So your supplies are just gonna be a small bag of saline, not a large one. And your blood tubing. Okay, and you guys have that in your skills kit. Do I need gloves for this?
No?
No, I don't, it's clean. Okay, so, take it out of the package, and here's our wide tubing. Okay, the first thing I'm gonna do is tear off all my little pieces. Okay, then I'm gonna close everything. So I'm gonna clamp, and close. Okay, my protective caps are still on. So I'm gonna choose one of these, it doesn't matter which one, and I'm gonna go ahead and spike my saline. And remember I told you it's best to fill the drip chamber before you do anything else. It'll stop as much air. This filter has to be covered with saline, okay? So I'm gonna go ahead and undo my saline. And I'm gonna just let it free flow to the end. And then I'll worry about covering everything. Oh no, I'm gonna fill my drip chamber. See how much air I got just from doing that? Just totally contradicted myself. Open? Oh, thanks, guys. Okay, close that. And now you can continue to fill it over the filter. I don't think it'll do it when you run it through. That's kind of a bad example. You better look at Miss B's.
Can you burp the bag before you spike it?
I guess we could.
Maybe
No,
help
I
you
don't
just-
know. This was a brand new bag. Shouldn't have too much in it. I don't know. You could
Is it
do
not
whatever
working?
you need to get, I just
Oh.
have some air.
Oh.
Even though I had told him that we wouldn't have it.
Really?
Oh, yeah.
Okay. Then you want to open your blood side to prime that as well. Just until you see it come out. It's in the cap. Okay, so I'm going to close that. I'm going to close my saline. And then I'm going to go to the blood bank. Okay, so when we do testing, you are going to have to deal with these and reuse them. But I just wanted to show you today for. Okay. So I have all my information. I'm going to walk over to the lab, and your blood bank is going to be right here for you. And you're going to have to choose the correct blood, okay? So I know the patient's name, his date of birth, and I know his blood type, right? Okay. So what type of blood can the patient take?
A
A
negative.
negative and
O negative.
O negative. That's it. So anything else, I'd put out of my way. Here's A positive, that's not going to work. Here's A negative, that's an option. O positive's not going to work. Here's another A negative, O negative, B negative, and another O negative. So here's the ones that I have to choose from. Now, we might put out a few to stump you, to make you think. So you're going to have to look at all the components we talked about. Make sure it's the right patient. Make sure it's not expired. Make sure the donor numbers match. Okay, so I'm going to go ahead and start checking those against my chart. And I have Robert Davis, date of birth 3/25/1948. This is A negative. It expires today. Donor unit is 000-65457, 000-65457. Now, if this is correct, should I look at all these?
No.
I mean, if you're neurotic and you want to just double check to make sure one's not better. Now, if the patient's A negative and they have an A negative or O negative, which should you take?
A negative.
A negative. But is it wrong to do O negative?
No.
So we do fail you for that.
Is the order for 2 bags or 1? And if it is, we need
It's
to
for
grab.
never, you only give one at a time. Good question.
Right. Okay.
Only in emergency.
Oh, right.
Only in an emergency would you do more than 1 unit. Okay, so we give one at a time because it expires after 4 hours and stuff like that.
Makes sense.
Okay, so I feel like I have the correct unit of blood. There is no checking verbally at the blood bank. If you need to talk out loud to get the right unit, go ahead, but it's not part of your, as long as you come back with the right blood, the lab, the blood bank, there's no skill check for the blood bank. Okay, hi Mr. Davis, I'm back and I'm gonna check your blood with my nurse, Nancy Nurse. Nancy Nurse is with me. Okay, so Nancy Nurse, can you check blood with me? Sure. Okay, remember, you need to know this. The most important safety feature is checking the blood with the patient. A lot of you are going to be this. You're going to be in this chart constantly. Your focus needs to be this unit and this arm. Okay? I have Robert Davis, and Nancy Nurse says Robert Davis. His hospital number is F00712-367. Hospital number F00712-367. Date of birth 3/25/1948. Date of birth 3/25/1948. Okay, I can't get anything else from this armband. Everything else is on here. Okay, Nancy Nurse. This is A negative blood, and the patient is A negative. It also says on here A negative. This donor unit is A negative, A negative. The donor unit number is 0006547. She's going to say 0006547. And it expires today, and she's going to say it expires today. Thank you, Nancy Nurse. You can go. All right, so you can dismiss her, and then you're going to apply clean gloves.
Leaks, bubbles,
Oh,
and
see?
clots.
I'm failing my skill. Thank you. Now, had I not caught myself, I may say, is there anything else you would have done with the unit? I might throw you a little bone. Since I forgot, now I'll have to, right? I'm going to assess as I'm walking back from the lab for bubbles, leaks, clots. And I see nothing. It looks good. Okay. And then you're not going to spike that one. You're going to spike one of these beautiful Kool-Aid looking things. Get familiar with your hemostats, okay? Okay. Mr. Davis, I'm going to stay with you for 15 minutes while your blood is started to make sure you don't have any symptoms of a reaction, and you let me know if you feel anything different than your norm, if you get a headache or if you get some back pain or you itch, anything. If you'll please let me know, and I'll make sure your call light's there. Okay, remember I said we don't want to start the 15 minutes until we have to? Because if we run this at 1:20, it's going to take a long time for it to get to the end. Being the impatient person that I am, we're going to let this blood run through faster to get to the end here, okay? When you see the blood get down to about the roller clamp, close it off. And I know that his IV is patent because I already checked it. I don't need to check it again. I'm going to scrub my hub for 30 seconds. It's a long time. 30 seconds.
Can we do that?
In my world. No, we have to be, we'll really do it. Just for testing, for demonstration purposes. Okay, I've hooked him up. I'm going to unclamp it. Remember, it's clamped everywhere, so it's not going to run. And then I'm going to put it on the Alaris pump to run at 120 an hour, 2 mLs a minute. Now, I believe we are going to have you actually putting it on the pump. So if you have not worked with Alaris, you need to practice. Okay? Now, this pump has locked it in. I can open everything up right now, so I won't forget, and nothing will run until I tell the pump to do that. Okay, so I want to double check that my saline's closed, my blood is open, and everything's open, right? I'm just going to power on my pump. Okay, it's going to ask me if it's a new patient. Do you know if we're requiring them to do the pump? Not sure?
Not sure.
Okay,
Sorry.
so I'll make that clear to you all or I'll have Miss B announce it, I'm not really sure. But if so, then walk through the steps on here. What it's asking me now is the patient's ID number, and so I put in the last initial of his name, which is what we do, and then you put in the medical record number. So D for Davis, and then I'm gonna put 712367. Confirm. Okay, then I'm gonna go to my channel select. You always wanna start on your blue channel, and this is considered a guardrails IV fluid. So it's gonna be guardrails IV fluids, and then I'm gonna go to P for packed red blood cells. And it's not there. Oh, red blood cells? Sorry. Losing all kinds of momentum
Oh, an
here.
older model
Maybe it's
too.
under blood. Blood. It's under blood, comma, RBCs or blood whole. So these are packed red blood cells. Is this correct? Say yes. It's going to give me an advisory to never run anything through the blood. Okay, we never interrupt it for meds or anything like that. So I'm going to confirm that I know that. I'm going to set my rate for 120 and my volume to be infused. I'm going to look at my bag, and of course this is a whole liter. But our blood bank bags tell you how much blood is in here. This is 300 mLs. So put 300. So I'm going to start my rate at 2 mLs a minute or 120 an hour, volume to be infused 300, and hit start. Okay, Mr. Davis, remember, if you feel anything funny, you need to please let me know right away, okay? I'm going to sit with you for 15 minutes. So you have your baseline vitals before you leave the room. You'll reassess the site and get a set of vital signs, your 15-minute vital signs. Actually, we do 5-minute vitals? We're going to have a 5-minute vital signs and then a 15-minute vital signs.
Is that when you note the time?
I would note my time right when I hit start.
Okay.
Okay, so you note the time when you hit start, not when the blood gets to the
For
hub?
testing purposes, it's already pretty much there, is that what you were saying?
Yeah, when we test, I'm not going to make you wait for this to get
Yeah.
red right here.
Okay.
Oh, okay.
Start your 15 minutes right when you hit this pump.
Okay.
But in the real setting, we are going to wait. We are going to get the blood to the end of the tubing. I'll disconnect it and let it run to get there. It's just silly to wait. Okay?
In the hospital, you'll do that?
Yeah. Because all it is saline. We just want to get the
Yeah.
saline out of the way and
Yeah.
get the blood into the patient. You can stop the camera, Missy.
Okay.